Good afternoon, everyone. Welcome you all to this interesting panel. We have a very unique set of panelists here. There is a policymaker who decides what needs to be done. There is a doctor, what kind of precautions we have to take. And there is an educationist who's going to tell us what, because everybody is jumping. I think I'll have to mute you, ma'am. So everybody is jumping on the bandwagon saying that they are also online, but not many seem to have a clue as to what is happening. So this is a very interesting panel. Just to introduce the panelists, I have great pleasure in introducing Dr. Kalpana, IAS, MBA, and a PhD from IMB. And she's an academician also at heart. So it's great to have you, ma'am, here. And she's in charge of, she was formerly the Secretary of Education. Right now, she's taking care of the Department of Youth Affairs. And the second panelist is Dr. Bala Venkat. He's an anesthesiologist by qualification. And their hospital has done some enormous amount of research work after the COVID became a major issue. And since he's working in the trauma care hospital, they didn't have a choice but to continue with whatever is happening, whatever they had to do as doctors in their hospital. So they've gone in depth, they've analyzed, and he has a lot to share. We look forward to sharing, listening to you, Dr. Bala. Thanks for being here. Thanks for accepting our invitation. And let me introduce Ullas Kumar. Ullas is the man with the magic touch right now. He's helping nearly about 800 schools, and he's also helping nearly 3.5 lakh students to learn online. So that's a huge amount of workload that he's carrying, and he will have a lot of, in fact, the many questions that have come are addressed to Ullas. Over to you, ma'am, to set the ball rolling.
And thank you, Dr. Mohan Narayan, for having me here. And thank you for the audience for joining us. This is an extremely topical webinar because most of all of us, after having gone through the pain of the lockdown and slowly emerging out of it, the question uppermost in most people's minds is what is going to happen with the schools? When are our children going to get back, and what is going to happen to their school year? So looking from the policymakers' point of view, I think we are looking basically at three questions. In the medium and the short term, why should we reopen? What is the imperative that we should reopen, in the short and medium term? Why not put it off indefinitely? And the second is the timing when we should reopen. And then if we do reopen, what are the safeguards? What should we do to be able to function properly? Now, looking at the imperative to reopen, here the priority is the health aspect. The Karnataka Education Minister put it that very few parents would want to send their children to school at this time. The health of the children is paramount. And there's also the public health aspect, because children can carry, they may be asymptomatic, but they can carry the virus load as much as an adult. And the range of contacts is much more than adults, and it is much more difficult to do contact tracing with children. But at the same time, there are other imperatives. There is the need for normalization. We are now understanding that we have to learn to live with the virus. And if we exclude the upper middle class category, for so many other children, nutrition is intimately connected with school, with the midday meal. So with the loss of the midday meal, the loss of school, absence from schools means loss of nourishment. So that is something which government is looking at. And a long break will also mean discontinuity for any student, but especially in the underprivileged category, we want to avoid the increase in dropout rates, because it's very difficult to bring the children back to school if there's been a long break. So this is with reference to why we should open. So the imperative is there. The second is the timing. When should we open? And by now, all of you know that we have not yet zeroed in on a specific date. We are going at it, exploring different scenarios, looking at the geography, but whatever the date, it is likely to be staggered, and we have to approach it with courage as well as caution. And when I say caution, what are the precautions? Now here we should look at both the public health, the academic and the emotional aspects. One thing that there should be safeguards in place, and we all know that staggered classes, social distancing. Academically, you are aware that NCRT had already released a calendar, alternative academic calendar, and going forward, we probably will go into a kind of 50-50, kind of blended learning method where at least partly we will be able to go online. And emotionally, the children need some time to stabilize and to understand. And if you see that there has been a lot of reassurance on the side of the government that there will be time, that you will be given time to study for your exams, you'll take care of the requirements. So I think basically the imperative to reopen, why and when to reopen, and then what precautions are to be taken. I think these three are paramount in the minds of policymakers as we move forward towards a decision in this area.
Thank you for setting the context. Ma'am, I would request Dr. Bala to share his initial thoughts.
Good afternoon, everyone. It's indeed a great pleasure. Thank you, Mohan Narayanan and Parivartan, for giving me this opportunity to share a thought as a doctor, as a parent, as a teacher, because we are a teaching institution also. I would like to put and how to get over it, how to win this. One statement came to my mind. This pandemic has produced an extraordinary challenge, which none of us had visualized ever in our life. But I also think we can win over this extraordinary challenge with ordinary solutions done with extraordinary discipline. I just like to repeat, the extraordinary challenge posed by the COVID pandemic can be won with ordinary solutions done with extraordinary discipline. Now, having gone through this for nearly 4 months, the world has learned what we should do and what we should not do. What we should do as a citizen of this world is, number one, to prevent the disease from, if suppose you are infected, you should be not transmitting to others. If every citizen in this world decides on this, then the virus will disappear soon. So what does it need to do this? Only 3 things, ordinary solutions are only 3 things. And the most important is the physical distancing, number 1. Number 2, to have a mask which will cover your nose and the mouth. And there was a lot of questions about which mask to use. And it's clear that now for a community use, it's enough to have a cloth mask or a cloth covering. And the third thing is good hand hygiene done repeatedly. And when you touch objects outside your house, before you touch your eyes, nose, and the mouth, you need to clean. I think this has been repeatedly told by everybody, but these are the solution to come over it. Now, when it comes to the school, the reopening of the school in any country is equated to returning back to normalcy. Because at the first stroke of any calamity in any country, the first thing done by the policymakers is to close the school so that to protect the children from the aftermath of a calamity. So whenever a school reopens, it is thought to be the beginning of normalcy of any country. And I would wanted to probably in my next session would speak more about it. But what is more important to know is that below the age of 10 years, the infection rate is very less. and even if they get infected, they passing that infection to the others seems to be very less in most of the studies across the globe. This is a very, very important and interesting finding, and we will deal more with this in my next session. But I am very, very hopeful that having learned to live with the disease, it is time that we decide to move forward and make sure that all of us get into a near normal routine with due precautions. And as a trauma unit, we did this when most of the hospital stopped working. We continued to work with clear principles to make sure that all the accident victims are treated. And I'm also happy to share with these measures that we took on the three important aspects I deliberated. No healthcare workers has got infected in our hospital. So the same thing probably can be replicated in other organizations, including the schools. Thank you so much, Mohan Narayanan, for giving me this opportunity. And I look forward for further deliberations in the course of this session.
Thank you, Dr. Bala, for sharing your thoughts. In fact, having no one infected in such a huge hospital is a tremendous achievement that calls for huge respect from everyone. Probably the schools, not only the schools, even the hospitals could possibly learn from the best practices that your hospital is practicing. Thank you very much. And we'll come back to you to request you to talk further on the points that the schools have to consider before reopening. And in the meanwhile, may I request Mr. Ullas? Mr. Ullas is the Director Academic Excellence of, for those of you who joined in late, lead schools. And right now he's helping nearly about 800 schools to he's helped 800 schools to go online, and they are catering to nearly 3.5 lakh students. So there is a huge amount of learning that Mr. Ullas can share with all the teachers who have logged in. Over to you,
Great.
Mr. Ullas.
Thank you, Mr. Mohan. Mr. Mohan, if you can enable me to share my screen, please. Yes, now I can. Okay. Good afternoon, everyone. It's very nice to be talking to all of you. And like Dr. Bala mentioned, I think the thermometer or the gauge to know whether a country is ready, or is out of the crisis is if the schools open. I think the one thing that all of us need to start to feel good about is that there are a lot of countries around the world that are opening their schools, right? So one of the worst hit was places like Indonesia, where we are already seeing schools come in, schools open, and like you see, there are infrared thermometers that are being used to measure temperatures of incoming children. This is Denmark. If you begin to see and imagine, this is how some of our classrooms are going to look like when they reopen. There we are going to follow social distancing, which means that you're not going to have more than 10, 15, maximum 20 students sitting in a classroom. So what does that really mean to our schools, where we are known to pack a lot of students into the same classroom? So how does that look like is a question that all of us are talking about. And also, if you look at it, many people talk about how the virus originated in China. The US president is known to talk more meaner things about them, but something that is heartening to know is that even schools in China are beginning to open, and all of this means only good news for us in India. However, it is going to still take some time for us to open. The government, Dr. Kalpana will talk further about it, but the government is deliberating on what are the safest ways of ensuring that our schools start. But what I wanted to start off on a positive note, but if I have to reiterate what are some of the challenges that schools are facing, especially teachers and school owners and principals. There are four major challenges, right? One of them is to ensure uninterrupted learning for all students. So for a lot of states and for a lot of schools, the previous academic year abruptly got ended. And for a lot of schools in the country, April is when schools start, but we've not been able to start schools. So a lot of parents, a lot of students are really worried about how will learning continue, right? And that is a challenge that everybody is currently thinking about. More the government, because they are responsible for a lot more schools, the government schools as well as private schools. So they're deliberating a lot on that. The second big challenge that a lot of teachers, including me, would resonate with is delivering high quality learning in all circumstances, right? Because I think when parents send their children to school, there's a lot of expectations that they have. And as teachers, it is our responsibility that we make sure that we meet those expectations. For a lot of parents, yes, the lockdown has happened, but their expectations, however, hasn't changed. They still want to make sure that their children can get an excellent education, right? That is where they are. But so what we have done as teachers is, we've sort of quickly moved on to the online offline mode of education, and we've said, hey, you know what, I'll start a Zoom class or I'll start a hangout session. I call all my students in there and I'll teach. This is a challenge that all of us are currently facing, and it's real. So delivering high quality learning in all circumstances is a huge challenge. The third piece being ensuring student and staff safety, right? So this is what Dr. Bala was talking about, and I'd let the experts answer that. And for a lot of schools, and even for the government schools, what this means is that there's a huge increase in cost. Also, that is involved when we do look at reopening schools, right? Because we didn't have or we never mandated disinfectants to be used to clean schools twice a day. We never mandated that everybody had to have masks and gloves. We never mandated infrared thermometers in every school. So there are going to be increased costs for schools and the school systems. So I think these are the four big challenges that will have to be addressed if we are looking at reopening our schools, right? So I'd pause here before I get into the solutioning more next. But I'd pause here and throw it back to Dr. Mohan. Thank you.
Thank you for sharing your thoughts, initial thoughts on what the participants should expect, Mr. Ullas. May I now request Dr. Kalpana ma'am to share what is the government line of thinking in terms of, because now the parents are concerned, like you rightly said, the parents are concerned about the safety and security of their children. So many parents with whom I've interacted, they say they don't want their children to come to school. In fact, some students said, even if my child has to lose 1 year, I don't have a problem. They're going to such an extent. And on the other side, if you look at it, the schools are keen on giving the online educations. But at the same time, now the unfortunate thing is some parents are sitting in judgment of the teacher's competence. That is also a challenge. That's another huge challenge. And in terms of when you look at it from the teacher, the school leaders' perspective, they say the government has asked us not to collect the fees. The parents are happy, but how do we run the schools? How do we meet our overheads? That's another concern that they have. When you look at it, the parents on the other side, they say, we are not getting our salaries, so how do you expect me to pay my children's fees? So these are few things that everyone is bothered about. If you can share some lights on that, ma'am, that would be useful for it.
Let me first speak about some general structural or institutional issues, and then I'll go into the actual nitty-gritty of the thinking. One thing is that we have to keep in mind that we have about over a crore of teachers, over 33 crore students, and 1,000 universities, and we don't even have the count of the number of schools that we have: private, public, grant in aid, small schools, kindergarten schools, so the countless. So we actually cannot have a one-size-fits-all solution. What we are now looking at is that exploring the different scenarios, and then MHRD will set the broad guidelines, and then the states will be preparing their own plans. And within the state government itself, I work for a state government. Each state is preparing alternative plans to meet different scenarios. So both with reference to geography, part lockdown, part open. As Mr. Ullas had pointed out, we may have a situation when we open, then we have to have a rollback, close again. So all these different scenarios are being explored, and different game plans are being prepared. And both UGC and NCRT are now at it, preparing the broad guidelines. As you know, NCRT has already brought out an alternative academic calendar. And MHRD has formed, the Government of India has formed a task force. And as you're aware, Ministry of Home Affairs has allowed correction of papers, and also that the answer sheets may reach the children's homes, the evaluators' homes. And the bookshops are also open, so that the children who have to write the examination, they can do so. Now, coming to the actual opening, we are looking at three aspects, as I pointed out earlier. One is the health aspect, the second is the academic aspect, and the third is the emotional aspect. Now, looking at the health aspect, it is going to be staggered. That is how things look now. We probably will have opening in the green zones first, and then move to the orange, and the red zones may have to wait for a longer time. It is more likely that the staggering will also be in terms of age. So 8th to 12th standard students, high school students as we call, they will their classes will start first, and then the younger students. Kindergarten will take probably a much longer time. So where the children are aware enough to know about physical distancing, they know the importance of hygiene, hand washing. So we are going to look at that category or that group and age group at first. And regardless of which class is open, almost everything which involves contact, canteens, common spaces, assemblies, contact sports, all this will be in abeyance for the time being. Schools will work in shifts, decluttered classrooms, rotational basis. You know that different states are looking at different, some are looking at odd even, some are looking at age, some are looking at 50-50. NCRT was talking about 50-50. So there will be a rotational basis or a shift basis, and that may be daily, weekly, or twice a day. So this is with reference to the health aspect. Now, academic, the most important question. Now we are all of us are thinking of health, but as a school, that may be daily, weekly, important question. Now we are all of us run into the course of the academic year. The single question which parents and teachers especially will be thinking of is how to finish the portions. So one thinking is that we'll reduce the number of holidays, and I anticipate that there will be a blended learning model, that there will be part online, part classroom. So maybe 50% would go online. Now this opens up possibilities, but there are also, we have to be aware of the limitations, because everybody does not have equal internet access. And internet access, as we also saw this afternoon, is a very tricky thing. We don't have that continuity and that in streaming and that strength that we can rely on it. But there, the option which we are looking at is that the classes will be, of course, streamed online, but then open platforms like YouTube or some other open platforms will be used to again display the videos so that the students can access them later, even if they don't have immediate internet access. So to take care of the differential connectivity issues. The third is, of course, the emotional issues, because there's been a break. Coming back to school will take some kind of anxiety will be there in the mind of the students. So children will require some counseling, some time for stabilization. And so these are, I think, broadly the things which we are looking at: the health aspect, the academic aspect, and the emotional aspect as we move forward to prepare our plans. And I would be glad for inputs with reference to any of these three.
Thank you very much,
Thank you
ma'am,
very much, ma'am.
for sharing the line of thinking that the government is looking at. In fact, being such a large country, it's very difficult to have a one-size-fits-all approach. And like you rightly said, in fact, an expert was talking in another discussion that I was part of. He was talking about each district coming up with its own unique methodology to handle the situation, depending on the severity of the infection in their particular areas. Like you rightly said, each probably the red zone, green zone, and orange zone, each one will have to come up with their own separate perspectives on that. Having listened to you, I would request now Bala to share the best practices that he's amassed in huge amount. Over to you, Bala.
Before I go on to what we did to make the hospital COVID-free in spite of steady flow of cases, patient attenders, I just would wanted to share a few points in relationship to the students, the children, COVID-19, and school as the place where it can multiply. We go by examples and we learn from the other countries. I would like to take the example of Sweden. Sweden never closed their primary schools throughout the pandemic, even until today. And they have done an analysis to see how many children got infected, how many of them carried the infection back home, and because of that, how many parents got infected. It is extremely revealing that the incidence of the infection in children, especially the primary school children, has been negligible. And the amount of transmission from them to the community has been very negligible. And the number of students or teachers getting infected and not coming to the school is very negligible. So Sweden has taught a lesson that schools are not the places where the infection thrives. Students are not the ones who carry the infection forward. And the learning across the globe is, even if somebody gets infected, when they are the kids, they don't land up into the intensive care unit. They have a mild symptom and they come out of it. Now, the biggest concern is, would they be an asymptomatic carrier and will they infect people in the house? This is something which we need to work on. If the children are coming from a joint family system where they have senior citizens above the age of 60 years, then once the lockdown opens and when the schools start functioning, the new normal is these children should have 100% physical distancing from their grandparents, and same objects or the same bathroom will not be used by the children and the grandparents until the pandemic gets over or until the vaccine come into being. So if we protect the elders at home, children going to the school will possibly lead to what many of the experts call it as herd immunity. The children, when they get exposed, when they get infected, they develop immunity to it. And if hundreds and hundreds of children become immune, they protect the elders from contracting the disease. And this is the concept of herd immunity. So this has to be approached with a note of caution, like what Sweden has done. They wanted to promote herd immunity by sending children to school. So this is one aspect which is very important, very pertinent, and we need to really work on these models. Number two, the Sweden kept the children, the primary school open for several reasons. And one of the reasons is they wanted the parents to come to work, especially the healthcare workers who were so important to treat the patients, and the policy makers and the government officials. Suppose if the primary school was not open, then these parents will stay in home and healthcare workers would not be available in the hospital, including the nursing staff, the paramedical staff, and the doctors. So this was one of the reasons why they kept the primary schools open. A cue we need to take from Sweden on this aspect. Now, when the schools open, I just wanted to share that what we did in our institution could be the norm in every school. Like it was Mr. Ullah sir did mention about it. So now we need to consider our building as a kingdom. So the school is a kingdom and the whole school is protected. Every person who is entering inside is screened, right from the staff to the housekeeping to the student by the thermal screening. And in case if they have temperature or symptoms, they will be sent back to the house. That is step number one. Step number two is at the entrance, you establish measures of just soap and water is sufficient. So we will have a series of water tap with soap solution available for all those who are entering inside. This will be a new modification which every school has to do. Number three, all of them will wear a mask or a scarf covering their nose and the mouth. Now, until the vaccine comes, this should be the modus operandi. And I think the schools in Sweden have also taught us that you have to kind of make shifts in the lunch time, in the break time. So each class is given a particular lunch hour. So the whole school does not have the same lunch hour. They will stagger it so that there is not a big crowd in the canteen and the place where they eat. And now inside the hospital, the next thing what we did was every patient will be allowed only with one attendant. So visitors were not a part of it, not allowed inside. We stopped all the medical representatives from coming to the hospital. So same thing will go to the schools, except for the student and the staff. Nobody should be allowed into the premises of the school to come for any kind of activity. The next thing that which we followed was everywhere where there is, for example, the pharmacy, the laboratory services, the X-ray room, the CT scan, the MRI. So all these places we had given specific appointments. So nobody was waiting outside. There was no reason for a close contact happening. And these social distancing measures, which were incorporated, made it simple that contacts never happened from one patient attendant to the other. And we also evolved a strategy that all the patients who come in an emergency situation were all kept in a particular floor, especially if they come from areas of containment zone or hotspot areas. One specific floor was allotted to them and barrier nursing was practiced very stringently. So that, and we also with consent sent the COVID test for them. Until the test came negative, they were all kept in the room. All that they need was supplied to the room, and they were never allowed to come out of the room until the test was negative. And when we took them for surgery, we adopted all precautions, including the personal protective equipment for the healthcare workers and a mask for the patient to make sure that the disease is not contracted. Here, at this juncture, I just wanted to add one point. The primary mode of communication of the virus is by aerosols or the droplets which is coming out of your nose and the mouth. This is the simplest and the most important process. It's not from the blood. Blood to blood doesn't happen. So the surgeons need not worry that he will contract an infection by operating. We have to worry only about the droplets which are emanating from the mouth and the nose. So we started giving anesthesia for surgical procedures in regional anesthesia, where the patient is kept awake. You just anesthetize that particular part which needs to undergo. So we don't give general anesthesia, which produces a lot of droplets. So by these methodologies of decreasing the droplet infection inside the operating room, we protected the patient and the healthcare workers. So I think these methodologies could be adopted. And the schools, I probably visualize when Europe has become the laboratory now. And if we see in the next 1 month, now six European countries have opened the schools. And if the infection rate is not very high, we need to take a cue from them. And we should incorporate all that they did to make sure that all the schools in the green zone in this country should open. And I think I will leave with these thoughts and would be ready to take questions later. Thank you, Mohan, for this opportunity.
Thank you, Dr. Bala. In fact, interestingly, this is a question open for all the three panelists. There's one gentleman who said if you are going to have staggering according to the zones, so won't the students in the red zone lose out on the curriculum? I think I would throw this question to Ullas to answer.
Absolutely. I think Dr. Mohan, if you would allow me, I would answer that as part of my presentation itself.
Please.
But I think this is going to be a huge point of concern, because staggered start dates, etc., would mean that children who are attending board exams, etc., they will have issues, and the younger kids will also have issues, because kids function when there is a routine, and when the routine breaks, and right now the routine has been broken already, learning will be difficult for them. So I'd be happy to address that as part of my presentation, but if Dr. Kalpana or Dr. Bala if you want to answer it, please go ahead.
No, I think Mr. Ullas sir, I think you can continue to answer as a part of the presentation.
So like what Dr. Bala said, I think the solution to the problems that I mentioned earlier are ordinary solutions done with extraordinary discipline, right? Because at Lead School, when we were met with the lockdown, we didn't know what to do, right? I mean, we sat down to think about it, and it was a 3 to 4 hour discussion in our boardroom, where we sat down and saw what is possible for us to do, because a lot of our children will not be able to complete their portions for the previous academic year. So what we did was we cobbled together a group of 10 of our team members, and all of my team members are teachers, so that helps. So we cobbled together all of them, and we said, hey, start teaching. We will record your classes, and because our our program is in such a way that teachers are given plans, the school follows a certain plan, etc. So there's predictability for us in terms of what we do. So that helps us. So what we did was we got our teachers, meaning people from my team, to start teaching. And over a weekend, we were able to start to teach, right? Because a lot of schools got shut on Friday. And by Monday, we were able to start off where my team was sitting out of their houses, and they were recording classes and putting them online, while students in their respective houses were accessing these lessons on either a smartphone or a laptop or a TV, whatever they chose. Now, what has happened over the last 60 to 70 days for us is that we've had a huge learning curve, right? Because I think when we started off, we didn't know what we were doing. But over the last 70 odd days, I think we've had a huge learning curve, and because of that, what we've been able to do is we've had about more than a crore classroom views where children across the country have gone on our platform, have accessed these classes. And right now we are operational in more than 800 plus schools with 3.5 lakh students. And like I said, 1 crore classes that were attended, right? But the reason why I'm quoting these things is not for me to say that, hey, you know what, at Lead School we did it, but more to share our learnings from what we've been able to achieve, right? So what we believe is that when the schools open up, there will be you as a school, you need to have 5 strategies or protocols with you so that you can be successful, right? The first one is you need to have a really strong learning strategy, a school operation strategy, a health and hygiene protocol strategy, medical support available at school, and finally, very clear roles and responsibilities for all of the different stakeholders, including teaching staff, non-teaching staff, principal, academic coordinator, everyone, right? So if I were to quickly just move into the learning strategy itself, the one thing that all of us have been talking about is an online offline learning relay of sorts, right? And this is the reality, and I think we have to accept it. I don't think there is going back on that, more so because I don't think there is ever going to be a post COVID world. It will only be a post-lockdown world, the way we see it, at least until the vaccine comes in. So if we are living in a post-lockdown world and we are always scared of when the next outbreak is going to happen, again, like what Dr. Kalpana said, schools are the most affected. So, uh, you know, one of the things that the government is going to do is to shut down schools. And as a school, you cannot provide an excellent education or even provide education, forget excellent, if your school is shutting down and opening every other day, right? So for you to be relevant, it is important that you need to have an online and offline learning strategy, right? Now, one of the things is, as a school with limited resources, it is very difficult for a school to start online classes, right? So see, typically an online class would, if your version of an online class is somebody getting on Zoom or somebody getting on Hangouts and teaching a class, and students on the other end are sitting and listening, it is not the best class, honestly, right? I think there needs to be more nuances there. And in our country, when a lot of our students might not have good internet, not have devices all the time, it is not possible or not feasible many times for us to have a synchronous learning environment where a teacher starts teaching and students at the same time are listening. You need to have an asynchronous learning environment that is created, which which factors in all of the problems that we in India face, right? So for that, one of the things that is important is, if you have competent teachers and people who understand technology in the school, you can attempt to do it internally. But my recommendation would be, why do you want to reinvent the wheel when other people are already doing it, right? So if you can find a curriculum and technology partner who can help you move into an online and offline learning environment, my request would be for you to explore such options. The second piece is around having a school operation strategy, right? And as part of the school operation strategy, the first thing a school or a teacher needs to do is to relook at the academic calendar itself. Because the current way we are looking at things, the entire first term might be over by the time schools reopen. And if the first term is over, to the gentleman's question before, how will you ever be able to service, to be able to complete syllabus, right? So it is important that you have an online and offline learning strategy. Otherwise, it will be impossible to complete this academic year. Not just this, our hunch is that even the next academic year will be under threat if the vaccine is not yet found. And even if we do find a vaccine, I think it will still take us some time. We are more than 1 billion people. It will still take us some time to ensure that vaccine is provided to all citizens in the country, right? So one, you'll have to look at academic calendar replanning. The second piece is having alternate day schools. You might want to divide your class into half and say one half comes on a Monday. On a Tuesday, they learn online. The other half comes to school on a Tuesday, and Monday they learn online. So, you'll have to have alternate day schools going on for them. Some of the schools, especially in Maharashtra, have always followed the double shift in schools. But however, with social distancing norms coming in, the double shift might not be relevant, because double shift was used because there was lack of space in a classroom or in the building. But right now, if we are down to less than 30% of the class being able to attend school on every given day, or even 50%, double shifts will be difficult. So, it might have to be a hybrid of an alternate day and a double shift that some of the schools might have to explore, right? So for a lot of schools, this is a lot of work, right? So what we've been able to do over the last 10 to 15 days is we've looked at what have been some of the best practices around the world. We've put down our thinking around how do you make sure that learning continues in a school. And as of today, we are releasing an open source handbook which contains all the things that a school needs to keep in mind when they are thinking of reopening. And we delve deeper into the learning strategies and all the other strategies that I was talking about. This is completely free of cost, open for everyone to use. We'd be happy to share some of these learnings. So if you look at this is how some of our classrooms might look like, with 6 feet distance and 4 feet distance, etc. And your bench placing would look like this. So we've tried to visualize a lot of these things for schools. And what we've also done right at the end, of course, roles and responsibilities for each stakeholder. And finally, at the end, we've put down an appendix with a checklist of all the different things that a school needs to keep in mind, that they have to be ready with before they decide that they're good to start, right? So this is a working document. This is available for anybody to download at this point in time. But as the central and state governments release more details and directions, we will be tweaking this document to make sure that it continues to stay relevant for all schools. So I think the one big thing that I want to put out there is that I think we've had a really steep learning curve over the last 70 odd days, and we'd be happy to thought partner, share, support schools that want to come onto our platform. Whatever be the engagement, we are happy to support schools at this point. Yeah.
Thank you, Ullas, for the elaborate response to the query that was raised. I have a few more questions which have come in through the YouTube and also the Zoom platforms. One question is probably Dr. Bala can answer. So how do we convince, it should be to Ullas. This question is to Ullas. So how do we convince parents to take the online classes seriously and motivate kids to participate?
Right. Dr. Mohan, I think this is a live problem that we are currently facing, right? Because for a lot of parents till now, online classes meant summer program, right? They were like, schools want to engage students in some way. They want to charge fees. They want to do something. That is why they've come up with this way of doing online class. That was the that is how a lot of parents felt, and that's where attendance was low in a lot of these online classes. But I think as the government begins to talk more about how schools will not open anytime soon, and as we talk more about how online and offline learning is the new narrative, I think what we've already begun to see is that parents are willing to move. I think we'll have to make it really visible for them, right? I think last year you bought a bag, you bought you bought stationery, you bought shoes, you bought water bottle. These were the things that you bought last year for a physical school. But this year, it might actually have to be a device with data pack on it and textbooks so that your students will learn. I think, sometimes we'll have to put it out like this to parents for them to really understand that we are not kidding anymore to say, online education is a fad, but this is a reality, and everybody just needs to move. And we see this change automatically in the next 10 to 15 days as we hit June, because most states, at least in the South, will start to open in June.
Thank you, Ullas. The next question is to Dr. Balavenkat. The question that she asked is, how about the transport discipline, sir? Probably what she means is, when students come to school, what kind of precautions should they? Not all parents can drop the children at the school. So if they have to commute by public transport, what kind of precautions should they take? Or even within their own vehicles, what kind of precautions should they take? Probably this is what she means.
I think the basic phenomena is the same, where the social distancing is a must. The primary mode of communication is through droplets. And if you wear a mask, for example, we are in close contact with patients. So the only thing is, if either side they wear the mask, a 2-meter distance is sufficient enough. So it's the same thing probably needs to be followed in the school buses. And the buses to be, in fact, the minute they enter the school, they have to undergo decontamination and disinfection. And this will become a norm and a protocol. If it's an auto rickshaw, it can be only one person. If it's a car, it can be two. So this kind of protocols to be followed so that they don't get come in close contact. Wear the mask all the time. The minute they get down onto the school, first is to wash their hands. I think these certain disciplines have to be followed. But the biggest challenge would be compliance to this by everybody at all the time. Even here, we find it so difficult that they to make sure that everybody follows the principle. Even the healthcare workers, compliance to the rules is found wanting when you do an audit. That would be our biggest challenge.
Thank you, Dr. Bala. In fact, one question to Dr. Kalpana ma'am. The question is, if you are going to ask us to follow the staggering system, who would meet the overheads of paying the teachers? Would you like to answer that question?
I didn't get the question, please, fully.
The question is, if the government comes up with guidelines to have staggering system, it would mean more work for the teachers. Who would pay for that? Would you like to answer that, ma'am? I mean, I don't think anyone can answer that.
Yeah. In any case, I mean, let me just get into this, because there were these questions on the differentials, and I'll try to answer that and this also. See, one thing is that when you are dividing it zonally, there would be a divide created. That those who are in the red zones would be laggards. Those who are in the green zones, they would perform better. So there would be an impact on performance. And see, it is inevitable. But again, here there are trade-offs to make. So we take decisions based primarily on safety. So number one is that, it is a fact that maybe the red zone schools or the red zone students would be, deprived of classroom teaching in one way, then they'll have to make up for it through online. So there is one kind of divide there. Then there is the other kind of divide, that there is the digital divide. That there are people with easy internet access, good connectivity. There are others who aren't. So there also there will be a divide created. The schools will have to come out. The education administrators will have to come up with ways to moderate this. With reference to the extra work, I think this is very much uh, private school, private management kind of questions. In a government school, you would hardly look at that particular issue, because government teachers are overlaid with so much other duties and responsibilities, which they just go ahead and do. Uh, Again, I think here also there would be a reduction of work in some way, because you are not handling the same student load as you are handling every day in a normal classroom setting. There would be you are dividing your energy between a classroom and online teaching. Part of your teaching load is being shifted online. Part of your teaching load is being also shifted to the parents. Remember that, because here when you are talking about not 100% homeschooling, but partial homeschooling through the use of online methods, then the responsibility of the parents also becomes more. You can't now leave everything to the school and go about your other duties and responsibilities. So yeah, I think every management will have to find a way, public, private, they'll have to find a way as to how to compensate, whether by reducing work in some other sphere. And let's be very clear that this is not going to be easy. This is not going to be a pain-free exercise, and we can't say that I, as a group, any particular group, should be insulated or protected from the ramifications, implications which are going to come in the future. The going through the actual difficulty of the lockdown is just one part of the exercise. The real challenge is going to come post lockdown, as we open up, because we are doing it gradually. We do not yet feel it in a complete way, but when we are opening up the economy and the economy starts functioning, all of us have to be prepared for change and function in a different manner. Be prepared to take some pain for the process. I think it is better to be mentally prepared for that.
Dr. Mohan, I'd want to weigh in there. Sorry, I'd want to weigh in there. I can hear my echo.
We can hear you.
Sure. So, I think what I wanted to say was the role of a teacher needs to be reimagined, right? Because I don't think if you operate from the pre-COVID world scenario to say a teacher used to do XYZ, and in the post-COVID world, when schools reopen, she will do the same XYZ. That's not going to be possible and feasible. I mean, at the end of the day, teachers are also human beings. It's impossible to do double the work or any of that, right? So I think what might end up happening is that certain components of class. So one, we might move to an alternate day scheme where half the students are learning at home, half the students are learning in the class. If that happens, what schools might actually end up doing is dividing half their teachers into online teachers, half their teachers into classroom teachers. That's a possibility. So the online teachers are only teaching students sitting at home, while the offline teachers are at school doing certain work. And what that work could be, it could be administering assessments. It could be, doing certain experiments. It could be making sure that doubts are clarified. It could be remedial. So I think the role of a teacher itself is going to change completely. Once we open up, and I think schools need to start reimagining that versus thinking that the load on the teacher is going to double.
Having been in education for quite some time, I tend to agree with you. Probably the technology would help us to offer more personalized learning, which can bring in this adaptive learning concepts, which would, like you said, the whole education has to be, the way of delivery has to be reimagined. That's one. And we'll probably take one last question, which is directed towards Dr. Bala. Now, the question is, again, they're worried about how do we handle the children? That's the one question. I mean, how do we educate the children?
Actually, I have gone through several of the insights given by several countries where the schools have been running. And surprisingly, I have found all the children who have been taught exactly what to do. So I think, contrary to our belief, children follow when appropriately educated to them. They really follow what we teach them, and they really strictly adhere to it rather than the adults. So there are few positive aspects which is clearly emerging now. Number one is children are least if infected. They will not be huge carriers with a viral load infecting others. And school is not the place where the infection will thrive. In fact, it is the hospital is the place where the infection thrives. So the place where I work is much more, that means all the hospitals have to be closed. And we have not done that across the world. And similarly, I think as we know the disease better, probably in another few weeks, majority of the schools will start opening up. And once that happens in Europe, Asian countries will follow suit. And another thing which has clearly emerged in few of the countries is open school. Like instead of putting them in a classroom, if you do the sessions in open, the transmission of the viral is very, very less. This is another new normal that we have learned. So probably India had taken a cue from this. I think in olden days, the classes happen below the trees. I think that probably will come back. The Gurukula teaching will come back because the virus finds it difficult to spread in an open air.
Let's plant trees now.
Yeah. Thanks, Bala. In fact, I happen to manage a school of design wherein learning under the tree, learning on the playground, everything was acceptable. The only challenge there would be, are the teachers mature enough to handle students who tend to be distracted? That's a huge challenge. But I take your point. In terms of going back in time to the Gurukula mode seems to be gaining ground. That's another one. So we've kind of ran out of time. So couple of panelists have other commitments to attend to. So to summarize, ma'am has said that there is, Kalpana ma'am from the policy perspective has said that there is no one size fits all approach. The government is coming. In fact, coincidentally, I happened to attend a session conducted by Anita Karwal ma'am, the Secretary School Education, Ministry of HRD yesterday. And she was telling that the next 10 days, they are going to come up with guidelines for schools on all the aspects that we've been discussing. So that would be a boon to every school leader, and that would help in a big way. The big learning from Dr. Bala is that the children are the least affected. So that's a good news. So let's believe in what he has learned through his experience, that probably we'll end up learning a lot more from the European schools and then practice, and then of course our own Gurukula system. That's another thing. And of course Ullas has come up with all the best practices that could possibly help the students, the schools, to offer learning. And the one interesting aspect that I learned from him is that having full-time online teachers, probably that would also help. In fact, that was one of the questions raised, but for paucity of time, I didn't raise it. One parent was asking, if my child needs special medical attention, how do we handle? So probably this could be the answer. So having said that, I thank all the participants, panelists, and Kalpana ma'am, thank you so much for taking time out and coming on board. And Dr. Bala Venkat, as you see, he's working from hospital. He's talking to us from the hospital. And he's also going on to conduct and moderate another session, a global discussion. So that's another learning. Probably we'll pick his brain another occasion also to learn from there. And thank you, Ullas, for sharing. And you've shared a wonderful handbook for the participants to come. And I thank all the participants who come in for all the interesting questions. And we look forward to having you all again. Please subscribe to our YouTube channel. We are planning a series of sessions. The next channel that we have is going to focus on the mental health. We are tied up with a leading doctor on that also, and there will be a psychologist, and we are also looking at having a major exponent on yoga also. So please do subscribe to the YouTube channel and stay tuned in for more updates. So thank you everyone. Thank you very much for joining us. Thank you so much.
Thank
It
you.
was
Thank you
wonderful
so
having
much.
you all here.
Thank you. Thanks, Mohan.
Thank you. Thank you.